President's health care overhaul will lead to an upcoming expansion of Medicaid, the health care program jointly funded by both the states and the federal government. But Medicaid was already causing financial issues for state even before Obamacare passed. So what are state governments to do? My next guest is sponsoring legislation that would let the states opt out of the program altogether. Here to discuss is Wyoming Republican Senator John Barrasso. Senator Barrasso, it's a pleasure. As always, welcome back to Freedom Watch. Tell us how this would work, Senator Barrasso. Take a large urban state like my own, New Jersey. Could the governor of New Jersey or the legislature of New Jersey or who, what authority would just say, you know what, we can't afford Medicaid anymore, we're not going to do it?
Well, they could opt out of this new mandate coming out of Washington. The legislature passes it, the governor signs it, and that would give the states what they need, which is freedom, flexibility, and choice. The mandates coming out of Washington and these 17 million more people being crushed onto Medicaid because of the health care law that, was passed in the middle of the night with nobody getting to read it, the one that Nancy Pelosi said first you have to pass it before you get to find out what's in it.
Right.
As the states are finding out what's in it, they're saying we don't want this for our state. They realize how much more expensive it's going to be, and the cost, because a lot of the cost comes down to the states. The cost is something that is meaning that they have to cut spending on things like education, like firefighters, police, public safety, and the states are saying, enough, we don't want this. And this is a piece of legislation that I introduced along with Lindsey Graham that says, let the states decide. And I would think for a member of the Senate or House, Republican or Democrat, you would have to say, yes, let the people of my own home state make that decision, because Washington sure doesn't know what's best for the people in my state.
All right, Senator Barrasso, as I understand the law, Medicaid itself is voluntary, but by 1982, all of the states had signed on, the political pressure having caused them to do so. Now, many of them are finding the basic Medicaid that they provide today they can't afford. Would your legislation say to them they don't have to do that? Or would your legislation say they can opt out of the added Medicaid that Obamacare will impose on top of that, which they already do and they already can't afford?
This allows them to opt out of the Obamacare mandates that come on top of the Medicaid that has already been there. We want to make sure that patients get the care that they need from the doctor that they want at a price they can afford. And that's what my goal has been underlying this whole discussion on the health care law.
Right.
Medicaid, and the president, he misuses the phrase coverage and care because he says coverage, but that doesn't mean you can necessarily get care. There are people that may have Medicaid cards but aren't able to get care. And I think states, and I saw that in my home state in Wyoming, in Wyoming, we can do it much better, much more efficiently, handle more people for less money than having to deal with these one-size-fits-all Washington mandates when Washington doesn't know what works best either for your home state of New Jersey or my home state of Wyoming.
All right. Recently, the Department of Health and Human Services initiated a ruling or a proposal that would require insurance companies to share health care records with the federal government. You're a physician. You know, in addition to being a senator, you know how sacrosanct medical records are. How did we get to this point in our history, Senator Barrasso, or a federal bureaucrat, not the Congress, but an unelected bureaucrat is saying to insurance carriers, cough up the medical records when we want them?
Well, you and I both have talked about the fact that we have an administration that is really out of control, overreaching, impacting on our own personal privacy issues, and right now they want the medical records of all of the patients through the private, who get their insurance through private health concerns. And look what happened with WikiLeaks, with lost computers from Washington bureaucrats. Who pays the price for that? Well, the people whose own personal privacy has been violated.
We'll all end up seeing those medical records if they get in the hands of bureaucrats. Senator Barrasso, it's a pleasure. Thanks for joining us.
Thanks for having me.